Hello, you're welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is an online health magazine program in which we take look at fail-proof principles and protocols for regaining health and retaining health. You're welcome. Okay, today we are discussing something that is very important and of late became really very rampant. Okay, we are discussing depression. So we want to look at how to overcome depression naturally. I warned them, I'm a pastor, and I warned them in church at the beginning of the lockdown that there's another epidemic that will follow on the heels of the COVID, and that was depression. And it has been like so. We have seen cases of depression really increase because many of the things that happen during the lockdown, as we'll be talking about it, are things that could actually cause or trigger of depression in different people. Okay, so today we are discussing overcoming depression. Depression is twice as common in women, than in men. And then when people reach the age of 60, or even from 45, 50 they begin to experience more depression. From 60 and above, depression can actually be really rampant. What is depression? Depression is a strong, now these terms I'm using are very important, strong, persistent, protracted feeling of sorrow, of unhappiness, and low mood. I'll say it again. Strong, protracted, persistent, more than 2 weeks, feeling of sorrow, unhappiness, and low mood. Okay, so that is basically the definition of depression. Now, if you wanted to add to it, you'll say it is a state of unhappiness, low moods, and sorrow that is strong, protracted, persistent, and that is severe enough to intervene in the person's daily living. Okay, so when people are depressed, what we are talking about is not just that they are unhappy. It's not that they are just sorrowful, but they are sorrowful enough and unhappy enough for long enough, it begins to hamper their normal daily activities and life activities. It's very important. What are the symptoms of depression? Okay, there are about 10 of them. If 5 of these apply to you, then you are depressed. Clinically, you are depressed. Okay, so number 1, feeling sad, pessimistic, or hopeless, feeling of sadness, pessimism, and hopelessness. Number 1. Number 2, feeling helpless and feeling of guilt. Feeling helpless, feeling worthless, and feeling guilty many times for no just cause. Okay, that's number 2. Number 3, some people will feel extremely tired, frustrated, and irritable. Extremely tired, frustrated, and irritable. Number 4, lack of interest in the activities that either used to be something that was pleasurable to you. So lack of interest in activities that used to be pleasure. Okay, the person begins to lose interest in the activities that used to be pleasure. What else is a symptom of depression? Okay, difficulty in maintaining concentration, forgetfulness, a difficulty in remembering details, and then you see sometimes their judgment begins to go down. That's number 4 now. Number 5. Number 6, sluggish thinking. Sluggish speaking, or sluggish body movement. Sluggish thinking, sluggish speaking, or sluggish body movement. Number 6 or number 7, undesirable changes in the person's libido. That's in their desire for sex. Okay, so either their libido goes up or abnormally, or it falls below normal. Okay, also all undesirable changes in appetite. Okay, so appetite changes, either increase in appetite or drop in appetite. Some people, when they are depressed, they eat more. Other people, when they are depressed, they eat less. Also undesirable changes in sleeping patterns. Some people are either unable to sleep or sustain a good sleep, or some people begin to sleep too much. Every time they just sleep off. Every little air that blows on them, they just sleep off. Number 7, or is it number 8 now? We are looking at the symptoms and the signs of depression. Physical aches, pain, cramps here and there, and then it can also be combined with digestive disorders. Either the person is having constipation or the person begins to run diarrhea. Okay, now next one, crying for no obvious reason. You just break into tears. You easily come to tears, and you didn't used to be like that. Okay, you easily come to tears, and then you check, nothing really warrants that in or around you. It may be a symptom of depression. And then thought of suicide, or thought of harming oneself, or thought of harming other people. Okay, so those are there you have the 10 thereabout. If any of these 5 apply to you, medically we say the person is in clinical depression. If any of these 5 apply to you, you might need to rewind in order to hear them very well. If any of the 5 apply to you, we say the person is in clinical depression. Now, there are different forms of depression. I will quickly run through them. Sometimes there's major depression. Depression, you know, we say strong feeling of low mood, unhappiness, and sorrow. That lasts for over 3 months. The person is just down and the person cannot come out of it. Okay, so forms of depression, major depression, dysthymia. I will not be bothered to explain some of these things. Psychotic depression. In psychotic depression, the person begins to behave like a mad person. Actually, there are episodes of paranoia or hallucination. They are hearing voices or seeing things that are not there. Okay, and then there's also exhaustive depression. This is depression that comes on the heels of tiredness, prolonged persistent tiredness. You can also call it burnout depression that comes on people when they are burnt out. We have many leaders, many great people who eventually burn out and they slip into depression. Postpartum depression is another form of depression. A woman just gives birth to a baby and then she slips into depression. Okay, there's another one called SAD, S-A-D, seasonal affective depression. This happens more in the temperate regions, in winter countries, where they have extended months of coldness and darkness. Okay, so they have longer hours of night than the day. Okay, and it's just cold, everything. So there are some people at this point in time every year they enter into depression, and this is a bit of what happened. This is why COVID also sparked up or triggered up a whole lot of depression in so many people. Okay, we'll talk about it more. There's another depression called bipolar depression, and or manic depression. Today the person is happy, over happy, and then the next day the person is sad, over sad. Just like that. For 1 week he's over happy, he's literally hilarious, okay, or is hysteric, as we should say, and then the next 1 week they are just down and all that. So they swing between mania and depression. We call it manic depression. There are 5 biotypes. But there's a man called Dr. Walsh. He helped us to divide the types depression into 5 different biotypes, and I'll quickly run through it. Don't bother if this didn't if it doesn't make any sense to you. You'll still be able to pick some things from it. In a study, he studied depression for many years, a couple of decades actually. He was able to divide depression into 5 types based on their causes. Number 1, they found out that there are depression that are caused by high folic acid in the body. This accounts for over 40% of women of people who are in depression. Over 40, high folic acid in the body. We call it the undermethylated depression or undermethylation depression. There is also depression that is caused by low folic acid in the body, and this is called overmethylation depression. The undermethylation depression accounts for 40% of depression cases. The overmethylation depression accounts for 20% of depression cases. There's another one called pyrrole depression. Pyrrole depression, it accounts for about 15% cases, and it is as a result of excessive production of pyrrole molecules in the body. Pyrrole molecules are produced when we are stressed, and then when there's excessive production of that in the body, it can lead to pyrrole depression. Now, there's copper overload depression. Copper overload depression accounts for 70% cases of the depression. So in this case, there's excessively high levels of copper in the body. Okay, and then this particularly is a depression, is the depression that characterizes a change of seasons in women. When a girl goes from she's not menstruating, she begins to menstruate, it can lead her into depression. Or when a woman begins to have childbirth during pregnancy. Pregnancy is 9 months of severe interplay of hormones in the body. Or when a woman enters into menopause. Okay, so much of the depression that comes around these seasons is a copper overload depression. And then there's toxic metal overload depression. Toxic metal overload depression, okay, when somebody is poisoned with some heavy metals like arsenic, like lead, and like mercury. Now, what are the causes of depression? It can be genetic. In other words, it can be hereditary, but I usually will say that it is hereditary, that is genetic, doesn't mean you have to have it. If you attack it with lifestyle and you do things differently, it will not be able to get you down. We say it this way. Genetics loads the gun, but lifestyle pulls the trigger. So if genetics has loaded your own gun with depression, with your lifestyle, you can refuse to pull the trigger. And so long as the trigger is not pulled, a gun could remain loaded for a lifetime and not go off. That's very important, okay? Life events can cause depression. Losses, loss of spouse, loss of job, loss of property, loss of time, losses generally, loss of loved ones can cause it. Failures in academics, failures in career, failure in family life, divorce and all that, separation can cause it. Rape can cause it. Divorce can cause it. Changing jobs can cause it. And then betrayals also, disappointments, all that can cause depression. What else can cause depression? Negative personality traits. People who are melancholics, we have 4 major types of personality types. We have the cholerics, we have the sanguine, we have the phlegmatics, and we have the melancholics. Melancholics particularly, and then sometimes cholerics can, if they are extreme, it can position them to develop depression in life, because melancholics are always very moody and all that. What are the other causes of depression? Undesirable physical loss of sleep, undesirable loss of sleep. The person can't sleep for a very long time. That's why I keep saying, if you can't sleep, you need to do something about it. You need to speak out. You need to be helped, because if you remain in that state for a long time, you can't sleep, it can tip you into depression. What happens actually is that depression can cause loss of sleep, and loss of sleep can cause depression. So whichever one happens first, loss of sleep and depression go hand in hand. Depression can also be a side effect of some drugs. Some drugs like some drugs they use to treat cancer, some drugs they use to treat hypertension, some drugs they use to treat high cholesterol in the body. Stavastin drugs can cause depression. Severe illnesses, the person is sick and you are afraid for life okay, you are in fear of life, it can cause depression. Okay, somebody is sick with cancer, or you don't just understand your body, especially they are doing tests, they can't find what is wrong with you. It can tip somebody into depression. Poor dieting is a major cause of depression, and we're going to talk about it. Lack of exercise, staying in one place. So that's why during the lockdown, many people came into depression because they just stayed indoors 24/7. Some people hooked on their phone, hooked on their TV, watching films, sleeping, watching films. Very terrible lifestyle. And then many people came down with depression. Lack of exercise. We are not created to be sedentary. We are created to be very actively active. Okay, that's very, very important. We are created actually for the outdoors. We are created for fresh air, for all these elements to encounter our body. We'll talk more about it. Substance abuse can lead to depression, and then chemical changes in the brain can also lead to depression. Depression has many effects. Depression is the reason many families scatter. They started well, all of a sudden your husband or your spouse that you married starts behaving like a devil. Many times is depression, but many people don't know that. They say, what's wrong with you, and all that. They begin to react to the person with at the same level as the person is reacting. Okay, I've seen many families scatter because of depression. Marriages can scatter because of depression. Ministries, careers can destroy. Businesses can be pulled down because of depression. Children and teenagers can go haywire because of depression. Friendships can scatter, work can scatter, family life can scatter, society can scatter, even the economy can be depressed. Okay, so several things. Depression affects several things. It affects productivity. It affects continuity in life. What should you do if you notice some of these things? I will recommend that you talk to somebody. Number one. By the way, do not forget, we are not prescribing in this program at all. We are just doing this for information's sake, so that you know that there's something to do about your case. The reason many people go from depression into psychosis, which is outright mental illness, is because they don't speak up early. They don't come out early. Many cases, over 80% cases of depression, if the people speak out early and there's early intervention, they can actually be helped. You can overcome depression permanently. So what is there to do? Number one, your diet. Remove these wicked and poisonous foods from your food. Remove animal fats and reduce animal proteins drastically. Stick with only fish. Very important. Egg, milk. One time somebody came to me. That woman was mental. And then I said, when did this start? She said it started when she wanted to lose weight, and then she started to do one particular diet, keto diet, and then she started eating like 3 or 4 eggs daily. After 6 months, she just started hearing voices. Okay, so animal proteins, excessive abuse of animal proteins can actually lead to depression, just like many other diseases. Okay, stick with fish, even that, do it very little. Very important. Stay away from coffee, from sugar, from refined and processed foods. Stay away from alcohol abuse and nicotine abuse, that's smoking. Stay away from drug abuse, narcotics. Stay away from them. Coffee abuse, stay away from it. Remove wheat from your food. A doctor, a toxicologist was asking me yesterday concerning why do I not recommend wheat? And I told him it's because wheat contains it's moderately high glycemic to start with, but it contains high levels of gluten. Okay, and that makes wheat, our body reacts terribly to wheat. Remove wheat from your food. Go for oats. Go for bulk oats. Plenty of oats. Make your cereals from them. Make your swallow for them. If you need to know where you can get your oats, just let us know. Stay away from hydrogenated fats, butter, margarine, and oils that after you use them, you keep them. They solidify. Any oil that solidifies on standing is not good oil. Stay away from it. Very, very important. So diet. Stick more with plant-based foods. Eat oats. Oats is very good. Oats also contains 5-hydroxy. It contains tryptophan, and tryptophan is also very good. Tryptophan is a precursor for production of serotonin, and it's very good. Again, don't forget, you need to share. It's so very important. You need to subscribe. It's important. Turn on your notifications so that when we release new videos, you can know about it. And then help us share this. Okay, before I also forget, this topic that I'm dealing with are excerpts from my book, Reversing Depression Naturally, the book that myself and Daniel Ekele wrote. Okay, so if you want to know more about this that we are saying, you need to order this book. Very important. Something can be done about your depression. I tell you, you can overcome depression. Okay, so eat plant-based foods: oats, millet, guinea corn. Eat yam, potatoes, especially Irish potato, yam, amala, and all that. You can eat all that. Okay, eat more plant-based foods. They are helpful. Beans, legumes are very wonderful food. They are very wonderful food. All right, and then learn to get in the habit of blending and drinking vegetables like cucumber, cabbage, carrot. Blend them, drink them. If you like, you can sieve it before you drink it. If you like, you can drink it with all the fiber thereof. It's very good for your body, cleanses your system, and it removes. It's a good way of detoxifying. Other things you should do concerning depression: exercises. Get involved with exercises. Don't be sedentary. Don't stay in the house all day. Make sure you are active. You are actively involved in exercising. Our generation now is a generation of sit in one place. I saw a WhatsApp presentation recently, and it really blessed me. How that we actually spend most of our time either lying or sitting. Most of the time, and God didn't create us like that. God didn't create us like that. God created us to be highly mobile. Okay, so now that civilization and technology is forcing us to sit a lot. You sit at your table 4 hours a day, 8 hours a day, 12 hours a day. Sometimes you need to deliberately apportion out time for exercising, jogging, skipping, cycling, swimming, and then walking. Hippocrates said walking is man's best medicine. Walking, and if you can do it, add jogging to it. It's very wonderful. You need to exercise. You need to take about 8,000 steps a day. That's walking of about 1.5 hours in order to really be fit. Okay, so walking, very important. When you walk, try and do it around 8 a.m. or 9 a.m. under the hot sun. Under the sun, not too hot, a mild sun. It helps you. As the sun is beating your body, you are taking in vitamin D, and vitamin D is very good, as we'll hear later, in combating depression. Okay, also try and remain mentally active. This is why when people are aging, and especially when they retire, before you know it, they start coming down with all kinds of sicknesses, including depression. Try and remain mentally active. If you are retired, get involved with some training. Go and attend a Bible school. Just learn something. Get involved with some NGOs. Don't keep staying at home all day. That ain't good for you at all. That's not good for some elderly people. Have noticed it, and they find out that going out helps them. So you see many of them, they are in all the prayer meetings, they are in everywhere. They just want to be going everywhere, and their children will be telling them, mommy, sit at home, mommy, sit at home. Mommy knows how it is doing her. She knows that she needs to be doing all these things in order to remain sane and remaining alive. Sitting in one place is very terrible. And then use your brain. Be mentally active. Get involved with different kinds of training, especially online. Social connectedness also. Don't stay away from people deliberately. Don't be too absorbed into yourself. Don't be too extremely introverted. If you are extremely introverted, try and work on it. Have some friends. Have places where you go. It's so very important. That's why church is important. Church is important, and then if you can, get involved one way or the other. Good music, especially music that suits your personality, it's also very good. And I must say, when you pick musics that do not inspire negative emotions in you, rather that inspire positive emotions. Very good. learn to balance your life work balance. Life work balance is very important, okay? Because if you work, somebody rightly said, all work and no play makes Jack a dull boy. I would say all work and no play makes Jack a depressed man. Okay, so balance work and life. Do work, but have time to enjoy life, enjoy your family, enjoy yourself, enjoy people around you, enjoy things around you. Very important. Okay, also work on your spirituality. Meditation is a very good way of overcoming depression, of not going into depression. Meditation, very fantastic. Devotion also helps. You know, people they laugh at people who go to church. They say religion is the opium of the people. I agree. Religion or spirituality, I would rather call it spirituality. It helps you keep hope alive. It helps keep hope alive inside you. And if hope is alive, depression will be far. Okay, so practice spirituality. People from the eastern parts, from the Asian worlds, they have seen that yoga is a very powerful way of overcoming depression, but they took meditation from us. So let them do their own meditation their own way. We too also do our own meditation your own way. Spend time to just introspect and then hook up to that person up there. All right, so those are the things you can do. Some supplements you can use. I've talked about vitamin C, vitamin D, vitamin D3, very important, and then B complexes. B complex is very good. Always be on B complex. Be on B complex. It's very good. And then with extra vitamin B1, B2, B3, B6, B12. You cannot miss it on the vitamin Bs. They are very important, but be careful of B9. B9 is folate, because folate can worsen some people's depression and folate can better some other people's depression. That's why you need for a practitioner to be able to tell you which one you are dealing with. Very important. I've talked about B12. Zinc is important. It's very helpful in depression. Selenium is helpful. Manganese and magnesium are very helpful. Iodine is helpful. And then also eating kelp can also help. There's something called 5-hydroxytryptophan. It's an extract of tryptophan, and it's also very helpful against depression. Okay, other things that are helpful in depression: inositol, taurine, calcium, magnesium, chromium. These are very helpful. And there's something called gamma amino butyric acid. Don't forget, all these things are very available. If you want to know more about them, just contact us, okay, and then we'll let you know where you can get them. Okay, what are the herbs that can be useful in depression? Kava is very wonderful. It's an anti-stress par excellence. Okay, it helps you to bear up with stress. St. John's wort is also very important. They did a study comparing the effect of St. John's wort and some other drugs that are depression medicine, and they found that St. John's wort is almost as effective actually as many drugs in the market. St. John's wort. Okay, lemon balm and chamomile are also very important. Lemon balm, chamomile, valerian, skullcap. All these are very good in battling depression. Lastly, rosemary. There's something called rosemary. Is very, very good in battling depression, especially the forgetfulness part of it. Do not forget, we have not prescribed, we have only informed, so that you know that these things are available. You can be helped. Listen, don't watch yourself degenerate until they begin to carry the person from psychiatric hospital to another. That will not be your portion. It will not be my portion. Do something. Talk to somebody. You can call us. We can help you walk your way out of depression. There are these books. I said this, we extracted some of these things we said here from this one particularly, Reversing Depression Naturally. Reversing Depression Naturally. There are other reversing books. Reversing Diabetes Naturally. It's also very powerful. And then Reversing Hypertension and Cardiovascular Diseases Naturally. It's also very good. And then there's a book. This book is a bomb actually. Make Your Food Your Medicine. How to make your food your medicine, so that you will not need drugs. Okay, and then there's sickness-free, fail-proof principles and protocols for regaining and retaining health. Do not forget to share. Do not forget to turn up your notification, and do not forget to subscribe, so that when we release further videos, you will know about it. Thank you so very much. Till I come your way again next time. Bye bye. Thank you.